But when Angie Abbas falls ill, it seems as if there's no solution in sight.
My migraines started when I was in the 4th grade, about 9 years old, and they were really bad.
The doctor at that time decided to send her to a neurologist, and everything came back negative, and he just classified her as having typical migraines.
After a couple of years, the headaches slowly diminish.
They never really found a reason and thought she kind of grew out of it.
Then, when Angie is 16, the migraines come back, worse than before.
It was like a sharp stabbing pain over my right eye. After like a month or two of it, they would get so bad where it would hurt just to like move my jaw. Like I could not speak.
She would oftentimes throw up, sometimes several times a day.
Angie tries taking over-the-counter drugs, but nothing helps. The family doctor prescribes pain relievers, but they don't work either. And around the same time, another symptom appears.
Her hands would be blue, Angie's feet would turn blue, and she just was cold all the time. And, you know, we live in North Iowa. You don't think that much about somebody being cold because it's cold.
Then, one morning, the headaches and poor circulation are eclipsed by something much stranger.
Angie woke up and came down the steps, and when she came down the steps, her head was moving like this.
I thought, well, this is weird.
So I immediately called the doctor's office.
We drive over there, and you know, my mom is like gripping the steering wheel, and she's so positive that it's a brain tumor. And
the doctor came in. He was very, very serious and started doing a more thorough exam.
During the exam, the doctor discovers something nobody was prepared for.
And he said, I think she's pregnant.
Three months ago, 16-year-old Angie Abbas began suffering from agonizing migraines, nausea, and mysterious neck spasms. Her family fears she has a brain tumor. Then her doctor discovers something no one expected. Angie is 20 weeks pregnant.
And it's just like, okay. It was a shock to, you know, I didn't want to look at my parents' faces.
Our first thoughts were, we can handle a pregnancy a lot easier than we can handle a brain tumor.
And so my mom and dad and I went to the ultrasound and found out it was a boy. I knew I wasn't ready for that kind of responsibility, so we looked into adoption.
Angie's headaches and vomiting are now attributed to the pregnancy. But that still doesn't explain her neck spasms. So 1 week later, the doctor refers Angie to a neurologist.
She didn't know why I was twitching. She said, it's some weird thing that you've got going on, but, you know, it seems to be okay, you're fine, and the baby's fine.
And the neurologist said, I want you to take this blood pressure medication. That might help with controlling the migraines, and otherwise I'll see you after you have the baby. And dismissed us.
Then, after 5 days, the spasms suddenly stop.
So, you know, we just all assumed that it was an isolated instance and didn't think too much of it.
10 days later, it starts up all over again.
And it was stronger this time. It felt like someone was pulling the bones in my neck apart.
I've never seen anything like it. It was almost like the movement of a bird.
Michelle immediately dials the neurologist.
And she said, you know, I really don't need to see her. It'll be okay. And I'm thinking, she, again, just kind of brushed us off.
Within minutes, Michelle gets another call. It's the OB's office. Angie's blood work has come back abnormal. They need to retest her.
She said, you know, I think it's some clotting thing that they are looking for. And I said, a clotting thing? I said, you know, my dad had a stroke at the age of 43, and before that he had pulmonary embolisms, and we never knew why.
They go in for a repeat blood test. A few days later, the OB calls with the results.
And he started going through the list, and one of them came back weakly positive.
The slightly elevated number is for an antibody called Antiphospholipyd. The doctor doesn't think it's high enough to be of concern, but Michelle does.
I started doing more research, and I found a syndrome called Antiphospholipyd Antibody Syndrome, or APS for short.
Antiphospholipid antibody syndrome, or APS, is a deadly blood clotting disorder. It can lead to strokes and heart attacks, and in pregnant women, it can cause extremely high blood pressure, a dangerous condition called preeclampsia, which can be fatal to both mother and baby.
I was very scared. I knew that this was something big.
As Angie closes in on her third trimester, her neck spasms are getting worse. Frantic, Michelle makes an appointment with another neurologist.
She basically said that it was nerves and hormones, and being 16 and pregnant was hard to deal with, and so that's why I was twitching.
I did bring up the fact that Angie had tested weakly positive for the anacardiolipin antibody.
And she just, kind of passed it off as, some people have higher numbers when they're pregnant.
Scared and frustrated, Michelle goes online again to look for answers.
As I was doing the research on some of these clotting disorders, I read that during pregnancy, there is a great chance of a stillbirth occurring. And a lot of these mothers would be put on shots of blood thinners and baby aspirin.
Despite doctors' assurances that her daughter is fine, Michelle is convinced that Angie's problems are rooted in more than just a difficult pregnancy. She starts giving Angie a daily dose of baby aspirin to thin her blood and asks that another series of blood tests be run. 1 week later, the results are back.
And she said, here are the numbers. Again, they came back slightly positive, but they're not going to do that APS diagnosis.
And she was saying, there's something wrong with her. You need to find out what's wrong. And they were saying, no, her numbers are not high enough.
Michelle was scared to death. She was shaking when she came to the waiting room to talk to me.
And it told my mom, it's up to you now. You can fight my battle for me, because I just didn't have the strength to do it anymore.
Angie is suffering, but tests aren't showing anything definitive. Then, 8 weeks before her due date, everything changes.
I woke up on July 25th, 2004, and threw up. I went downstairs and I said, Mom, I threw up.
Michelle is alarmed. Angie has not been vomiting since early in her pregnancy. Then she notices something else.
I did notice that she was having a little swelling in her ankles, and I thought her face was a little bit puffy.
Michelle's instincts tell her something is very wrong. She rushes Angie to the hospital. The OB on call is a doctor they've never met, Dr. Michael Faust.
Her blood pressure was quite elevated. She had some swelling. With those symptoms, it tells us that Angie was at risk for preeclampsia.
It was what Michelle had feared all along.
Left untreated, preeclampsia can lead to strokes and brain injury for the mother, and ultimately will lead to, probably fetal death as well.
With Angie's blood pressure skyrocketing, the doctors have only one option.
The treatment for preeclampsia is delivery. We can give medicines to buy some time until delivery occurs, but delivery is the treatment.
An emergency C-section is the only way to save Angie and her baby.
I was very scared. In fact, I even looked at Dr. Faust and I said, if it comes to the point where it's Angie or the baby, I said, will you please save Angie? And he said, I'll save them both.
Angie Abbas has had bizarre symptoms throughout her pregnancy. Now in her 32nd week, her blood pressure has shot through the roof, and she's developed a severe case of preeclampsia, which could kill her and her baby. Her doctors rush her into the OR for an emergency C-section.
They gave me a spinal, and 2 minutes later I was being cut open, and I could feel the knife on the left side of my body.
And it was just within seconds, we heard the baby crying.
The premature baby is 3 pounds, 11 ounces. He's rushed to the neonatal intensive care unit. And Angie's also in danger. Her blood pressure is still sky high from the preeclampsia.
The thing that Michelle kept talking about is that Angie could throw a clot and that it could pass through her heart or her lungs and either cause a stroke or could kill her.
Dr. Faust puts Angie on medication to protect her from possible blood clots and moves her to a recovery room. Then he calls in the hospital's chief hematologist, Dr. Walter Bate. Michelle tells him about Angie's elevated anticardiolipin count and her concern that her daughter has APS. But Dr. Bate explains that it is not that easy.
It is not a clear-cut syndrome. It's not like saying someone has a heart attack. They either do or they don't. With the APS syndrome, there's a lot of subtlety to it.
And most importantly, Angie has one symptom that doesn't seem to have anything to do with APS.
He had never seen anyone doing the twitching like Angie was doing.
Michelle goes back to the stacks of research she's collected, and this time sees something she hadn't noticed before.
Michelle emailed me some articles where it had been shown that young women with the APS syndrome had been found to have some movement disorders in a very few number of cases. I was quite surprised by that.
The articles are enough to convince Dr. Bate. He sets an appointment with Angie and her mom.
I looked at them and said, well, I have concluded that Angela has the APS syndrome.
I said, "You mean you're giving us a diagnosis?" He said, "Yes, I am." I wanted it to be wrong, but yet I knew in my heart it was right.
Antiphospholipyd antibody syndrome is an autoimmune disorder also known as sticky blood syndrome. Antibodies attack fat molecules in cell membranes, causing blood cells to clot excessively. These clots can go on to block an artery or vein and lead to a stroke or heart attack.
It was a mixed feeling. It was kind of like kissing my health goodbye. And I knew I was never going to be a regular teenager.
Angie's pregnancy may have saved her life. Pregnancy causes a woman's body chemistry to change and blood volume to increase. This made the APS worse and brought Angie's symptoms to the surface. Had this not happened, she could have gone undiagnosed until she had a stroke or heart attack and died. There's no cure for APS, but to prevent the deadly complications from clotting, Dr. Bate puts Angie on blood thinners. This finally reduces the twitching and other symptoms.
Angela had a very unusual manifestation of a very rare disease, which is why it was so difficult for people to recognize what was going on.
1 year later, Angie is back in school. The baby has been adopted, and his parents have named him Cameron.
I really feel that Cameron was our little messenger that let us know that Angie had this clotting problem.
Angie has grown close to Cameron's parents and is part of the child's life.
I think it's extremely important for patients to really get involved because the doctors can't read your mind. They can't tell how you're feeling or what you're thinking. You have to tell them because they won't know unless you say something.